For Health Connection Radio and Body Chemistry Associates, I'm your host, Jay Foster. I want to talk to you about a natural approach versus a traditional approach to bone loss, osteopenia, and the more severe case of osteoporosis. And the traditional approach, if you watch TV, all the Fosamax and some of the other ones have fallen off patent, so you don't see as much of that. They use the generics on some of the other ones, but they all do some similar side effects. But the new Prolia commercial is out, and you can look at it and decide on your own. I always suggest people listen to to what the announcer is saying without watching the video. Watch the video first with the sound, and then go back and watch. And then don't watch it, but listen to the sound is where you pick up all the side effects and everything. And they talk about, as they do with Fosamax and Actonel and Boniva and the other ones, that Prolia can contribute to jawbone fractures and thigh bone fractures. And, the thigh bone doesn't really break unless you're in a car accident. And there are plenty of evidence that the bisphosphonates, including Fosamax, and this one, they're even saying it, may lead to thigh or leg fractures. I mean, women are walking along doing just fine, and their bone breaks, their thigh bone breaks, and then they fall. It's not like they fell and then broke their bone. They broke their bone before they fell. It's called an atraumatic fracture, one that didn't fracture or a bone break that wasn't by a trauma or a fall or anything striking the bone. So after 5 years, and that's pretty well known, that Fosamax will increase the risk of those, and they're already putting it in the Prolia commercial. And, to take a drug that has a side effect of doing what you're supposed to, it's like, some of the SSRI drugs contribute to anxiety and depression, and like Prozac, and that's what you're taking it for, but it may make it worse. Same thing with Prolia, apparently, and other medications. If you listen to what they say, I'm not making this up, it's what they say, that it may increase your risk for bone fractures, and that's why most people would, are being prescribed it. And it's not your doctor's fault. Your doctor and endocrinologist are not taught well about the alternative approaches, the natural approach to bone health. We've been working with this at Body Chemistry Associates for 36 years, since 1982. And that's why we know that the number one mineral that would help reverse bone loss is not calcium and not dairy products, but it is magnesium. So a couple hundred milligrams of magnesium before bed, if your bowels tolerate it, best if it's a chelate or a gluconate or a glycinate, that will help a little bit. It's best to get a test to see how much you need, and then we can reverse it. And we've seen follow-up bone density tests, DEXA scans, that show that the minerals will reverse it. And also, when you're looking at a T-score or a Z-score, the T-score compares you to a 19-year-old. The Z-score compares you to someone in your own age group. So I don't expect an 80-year-old woman to have the T-score of a 19-year-old, maybe a 60-year-old or a 50-year-old, but not a 19-year-old. But that's what how they justify, not their doctors, but how the drug companies justify prescribing that, because they put those levels. Merck, who came out with Fosamax first, put those levels very, very low, and saying that you have to have their drug to reverse it. So magnesium is more important than calcium in reversing bone loss. We do tests to find out how much magnesium you need, but a couple of 100 milligrams usually is pretty well tolerated, especially if you lean towards constipation, because sometimes magnesium can cause loose bowels. The others are Bon Appetit formula, and that's a concentrate of proven MCHC, microcrystalline hydroxyapatite, which is like food for your bones, and that's why we call it Bon Appetit. And it helps to increase the Bon Appetit matrix in your bones. And new bone is a lot stronger than old bone. So even on a T-score, if it doesn't come up but you're replacing old bone with new bone, that's the way to go. After 5 years of using these kind of drugs, and they even mention it in the Prolia commercial, that it inhibits the cells that destroy bone, but you need those to make new bone. You need to get rid of the old before you make the new, and that's very well known in bone metabolism, and the fact that they're taking advantage of the undereducated public and undereducated doctors, and then they send you off, said, well, ask your doctor about this. And she says, well, in conjunction with my doctor, we decided. What do you mean in conjunction with your doctor? What do you know about it? Your doctor should be the one that decides that, not you in conjunction with your doctor. So that's just marketing. The bottom line is there are natural ways. Prolia and other medications and Fosamax have a lot more side effects than the ones I've talked about. You can find one I like to look at is drugs.com. They give you pretty well independent research on these, and you can decide. And if you want to try a natural approach and show after a year bone density getting better, you're welcome to give us a call at Body Chemistry Associates. Been doing this since 1982, 36 years, and give us a call about our Body Chem program of testing, and then we make specific recommendations for what you need. 1-800-CHEMIST is the number. And the website is 1-800-CHEMIST.com, and 1-800-CHEMIST spells out 1-800-243-6478. This is Jay Foster for Health Connection Radio and Body Chemistry Associates, and we'll be back with another topic soon.